Good afternoon, everyone. Thanks for joining us for this afternoon's COVID-19 Professional Education Quickenar. My name is Matt McDonough. I will be the host for today's event, and on behalf of myself and the entire ESRD NCC, I do want to welcome you to this event. We appreciate you taking time out of your day to join us today for this important topic. Before we do proceed past this slide, I do want to make a note and let everybody know that this call event is being recorded and will be published on our website within 72 hours. We'll usually have it up by tomorrow in most instances. So let's look at our agenda today. We'll talk a little bit about what this call is about, although if you've been on these calls before, you probably know that by now. We will then go and introduce our speaker. Our speaker today is Dr. Laura Cooley. I'll give her a more proper introduction here in a moment. And her topic today is COVID-19 communication, quick tips to connect. After our presentation today, and we'll take some time to answer questions and answers that you submit to us, hopefully, either using our chat panel or our Q&A panels. Now, you don't have to wait to that point to submit your questions. If at any time during the talk today you have a question for our speaker, please feel free to submit them. We will accumulate them as they come in, and as time allows, we will answer as many as we can. So please, again, at any time, please feel free to submit your questions. So this is our weekly opportunity for providers and professionals to hear from stakeholders and peers in the community who are adapting to COVID-19. Obviously, lots of changes going on with COVID-19, where things are reopening and new things are happening, and the situation is constantly changing. So these peers and these stakeholders are joining us to share their experiences in this new environment, and hopefully provide you with some strategies for you to use in your own day-to-day operations. And these are weekly calls, 30 minutes, that have a variety of topics. So that brings me to introduce our speaker, Dr. Laura Cooley. Dr. Cooley leads efforts for outreach and development for the Academy of Communication in Healthcare, the ACH, which is a nonprofit organization with the mission of improving healthcare through education, research, and practice that focuses on communication and relationships with patients, with families, and healthcare teams. Dr. Cooley also serves as the editor-in-chief for the Journal of Patient Experience. And additionally, she holds an academic appointment as an assistant clinical professor of medicine at Vanderbilt University School of Medicine. It's my great pleasure to introduce Dr. Cooley.
Hello, everyone. I am delighted to join the conversation, and thank you for that warm introduction. As mentioned, I have the pleasure of leading education efforts at the Academy of Communication Healthcare, and we're a nonprofit academic organization, and we focus on supporting clinicians and teams to have a stronger ability to connect with patients and families and their colleagues, and to form stronger relationships in healthcare environments. And I like to start any presentation by saying thank you for that introduction. And at the same time, I just want to say that the reason I really care about this work is that I feel we have a unique opportunity to reduce the suffering that people are inevitably having when they're managing their health conditions, and lately managing pandemic conditions, by some simple activities like connecting and communicating. And I'll personally never forget when this became really important to me, and that was several years ago when I took my father to what I hoped would be a positive encounter with his oncologist, and we walked in with some hope that maybe there would be another treatment option, and we walked out realizing that there really was nothing left to try. And I remember crying with my parents in that exam room and leading our doctor through a communication encounter that he really wasn't equipped to have with us. And he finally settled in and you know, spoke honestly and earnestly and helped us make important decisions. And I'll never forget how important that conversation was to me, and that the doctor and the nurse did get on our level and connect with us. And my father passed a few weeks later, much quicker than we thought, and this has always been important to me since then. So thank you for letting me be with you for the next several minutes. So I just want to help transition us to our topic, and let me pause for a second and check in to make sure that you're hearing me okay. So I'll ask one of our hosts to let me know that you're hearing my audio okay.
I hear you just fine.
Great. And then I want to make sure that I know how to advance the slides. So it looks like I can click next page.
There you go.
All right. So I'm going to advance us to help you think about some quick tips to connect. And I know we only have a short time together, and one of the reasons I was invited is what can we do to stay connected during COVID-19 pandemic context? And because of social distancing and increases in telehealth communication, our whole mode of healthcare delivery has been impacted, and it can lead to a feeling of disconnection with others, with our patients, with our colleagues, with our own friends and family. So what I'm hoping is that by looking at some pretty simple frameworks to help you form connections, it can just remind you of some things you maybe already know. And I want to encourage you to use the chat box as we go. We will have a Q&A panel in about 12 minutes. But in the box, I'm actually going to put some activity questions and invite you to type a response. So for those of you who are already asleep at the sound of my voice, I'm going to invite you to wake up and put something in the chat box. And so my question that you'll see there now is, how would you describe your latest emotional state, a word or a phrase? And I am going to say that mine is actually cautiously optimistic. So I'm typing in the box, and I invite you to do the same. I'd love to kind of get a feel for our participants. So would love to invite you to do that. I'm just going to pause for a minute and ensure that you have a chance to reply to all participants. So you'll see my response there. And as I give you this moment to type and chat, I want to acknowledge that some of you may be feeling positive feelings, negative feelings. You may be tired from a holiday weekend. You may be worried about things like your own finances or the condition of a particular patient or family who is or is not getting the treatment that they need. And so whatever you're feeling, you can type it in the box or you can hold it to yourself. I know sometimes we don't want to share our feelings. And so my point as we see these things come in is just to pause and acknowledge that during this time, more than ever, human connection and acknowledging emotion is really crucial in the relationships that we form, especially in healthcare. And there's a whole body of research that suggests that when we convey empathy and understanding of a patient's health beliefs and their values, it really enhances the patient experience and leads to better clinical outcomes because patients follow and adhere to their plans and their providers' recommendations more closely. There's much greater trust. And even though we are in these emotional states and we're worried and nervous and tired of this pandemic, we can still connect with each other. We can still connect with patients. And so that's what these quick tips are all about that I'll share with you today. And you saw the 5 that I had listed. I just want to hone on 3 because we do have a short bit of time together. And the 3 that I'm focusing on today are to be present, to listen, and to respond and provide empathy. And you'll be getting a link to a short handout that might be helpful for you. And so I want to invite you to think about this. With all the feelings that you're having, when you look at this clinician on the picture on the screen, what kind of feelings might they be having, and how would that impact their ability to be present? I ask you that because I really want to acknowledge that it's not easy when we have these emotional states going on for ourselves and reflected in the spirits of our patients to be present. And so some of the tips that I'll offer you about being present are as follows. Whether you're in a physical, in-person encounter with a patient or family or a virtual encounter, we want to make sure we set the stage. If it were to be a video or phone meeting, making sure your background is conducive, that the appearance, if it's a video, can be seen, that there's the noise level is appropriate, that you can hear each other. And when you're in person, we can really pause in the busyness of our days to try and collect our thoughts and think about things like taking a breath, minimizing distractions, and pausing to be present enough to establish some rapport. Just a brief moment of connecting with someone can build a foundation for stronger relationships. And we really encourage that when we're trying to be present, that means acknowledging who the person is before we dive into the clinical encounter. And that can be as simple as making some small talk before we get to the big talk, which is seen in a lot of research to build a much greater level of trust. So the next tip that I'll focus on is about listening. So I'm going to invite you to do another chat activity, and you can put in the box your response. Type your response to this question. How do we know when someone is listening? You can put a word or a phrase, and I'm just going to pause and listen, so to speak, as you have a moment to chat. So if you have your chat box accessible, I'd love to just pause and let you do that for a minute. So I see some responses coming in. There's a lot of mention of eye contact, so hopefully you're still able to see your patients in person for those of you who may be doing more phone visits or video visits than normal. Body language and eye contact can be challenging. We also have a lot of time and resource limitations that tempt us to jump in and interrupt. But we know that people are listening too by them taking a pause and just letting us say what we need to say, and then responding. So there is a lot that can be accomplished even just through the voice, even if you don't have a chance to make eye contact. And those short moments can be surprisingly impactful. Something that's interesting from the research on listening is that we often worry that if we open up a question and let a patient talk, we worry that they'll go on and on forever. And what the research shows is that on average, when invited to speak without interruption, most patients will go for an average of about 90 seconds. And that seems to be enough for us to give them a chance to say what might be important and to respect them and to just kind of non-verbally and then verbally let them feel they've been heard. So there may be clues in the tone of voice that we use or the stories that we let them come out that will let them know that we are listening and that we're inviting concerns that they might have. So the third piece that I want to emphasize today is about responding and providing empathy. And so when we listen, to make sure people know what we've heard, you've put a lot of good answers in the chat box. Some of them are about nonverbal behaviors. Some are about verbal behaviors, like giving a response or asking a follow-up question. We can also summarize what we heard by saying something to let them know that we're processing what we were just listening to. And so on my next slide, I'll just introduce you to a brief framework that we use at the Academy of Communication and Healthcare for Teaching. And we call these Parole Statements. And the Parole Statements give a verbal response to let people know that we not only heard them, but that we're empathizing with them and really validating that they have emotions, just like at the beginning chat response. You have your own emotions, as do your patients and colleagues. and letting people know that they've heard by summarizing their content, maybe even naming the emotion. So if I were looking at your chat box, I might say, gosh, I see that you named that you're feeling really exhausted. It must be tiring to go through all these treatments, especially during a pandemic. And that might give somebody a chance to realize that I did listen. Oh, I can see how you'd be uneasy, especially at a time like this. We're going to do our best to partner with you and help make this as easy as we can. Or I can really respect how hard it is to get into the clinic and get your dialysis treatment. And you know, we're going to try to make this as easy as we can under the circumstance. And so just responding with some emotion and recognizing that they've been through something because you were listening can really help people to feel that there is a sense of humanity and connection. And so, you know, these things can make a big, big difference. And so I'm going to invite you to engage with me in one more chat activity. And if you're looking at the screen now, you see a picture of an older man and a clinician. So I'm wondering, what do you think this patient is worried about? What's this patient thinking? So you can pause and just think if you want to type something in the box. Just imagine, well, what if this were your patient? What might your patient be thinking? Might they be worried about? Maybe this is a family member. I'm just going to pause and let you think, those of you who wish to chat. I see some helpful responses coming in, and we really don't know what people are thinking until we ask, and that means that we have to be present and we have to listen, and then we can respond with empathy and really start to dial in to what might be going on with that patient. So when we think about these statements of empathy, I just put these in the chat box, and I'm realizing I'm not sure if I've been getting them to all of you, but I hope so. I just put this into all attendees. Just put in some sample statements, phrases, like a partnership phrase. Let's work on this together. An emotion, you know, you say you're frustrated. And so when we think about the emotions of our patients and how to connect with them, these verbal statements can make a difference. And as I wrap up and invite you to say anything that you'd like in the chat box in terms of ideas or questions, I'll also let you know that I'm going to ensure that you have access to our brief handout that gives you this framework that we talked through. It has 5 quick tips. And so I'm putting the link in the chat box now, and in that flyer is just a short summary of things that you may already know, but we often forget when we're in the midst of challenging times. And you know, now more than ever, in the midst of social distancing and heightened uncertainties in our own lives and in those of patients and families, you know, this human element of connection is really important. And as we identify our own abilities to skillfully engage in meaningful and effective communication with patients and colleagues, we can remain human and connected, even in the midst of the changes that have been wrought by the COVID-19 pandemic. And so my final chat invitation to you is just to invite you to share what questions or reflections you might have in light of what I've shared in this brief time together. So I'll pause speaking and invite our host to step back in as is helpful, and invite you to insert anything you'd like in the chat box.
Thank you, Dr. Cooley. We've actually received a question here, and I'm going to advance to our question and answer slide here. So one of these questions that came in, it came into the host directly. They have, I'm paraphrasing the question, their issue is not with necessarily the body language and the eye contact. It's, they use the word extract, and I don't think that's the right word to use here, but when a patient is obviously troubled and not communicating, what are some strategies to convey that empathy and to not pressure, but to continue to resolve the issue?
That's an excellent question, and it's hard to know. It depends on if you have a relationship with that person. I think what can sometimes be important is just using an open-ended question. So sometimes we're tempted to say, "Is something bothering you?" And if we say, "Is something bothering you?" the answer is going to be yes or no. Whereas if we ask an open-ended question like, it looks like something's on your mind, what is bothering you? It might still be nothing, but thinking about how to be more open when we ask questions, when we invite people to say what's on their mind, can certainly make a difference. I also think that beginning piece of kind of being dialed in and present and being building some rapport up front helps us establish a grounding of trust so that people might be more likely to open up. And if they don't, sometimes people just appreciate that they had the invitation, even if they don't feel like saying something.
Absolutely. When you're speaking, it reminds me of when I talk with my son, and the tendency is to say, "Are you okay?" And 99 times out of 100, the answer is yes. I don't give him the opportunity to share, and it's a great strategy. Thank you for sharing that. Another question / comment came in. What are your suggestions for providers when it feels uncomfortable for them to, a lot of folks have difficulty with eye contact, just in general, introverts or whatnot. When it feels uncomfortable, do you have any suggestions to help get over that obstacle?
Yeah, I think with that and with many of these communication habits, it does help if you can get a chance to practice, practicing with a colleague or a friend. And I know that sounds a little silly, but it can make a difference. And sometimes I've heard of people trying little practice activities, even just like getting in the elevator and making eye contact and smiling, or like little moments of eye contact if that's the thing that's a little bit uncomfortable. And I think if at the very least this idea of being present can be top of mind, at least trying with intention to make eye contact at the beginning of an encounter when you greet someone. That can at least kind of establish that moment. And then, it's not like you need to stare in their eyes the whole time. That could be awkward. So I'll stop there and just acknowledge that it's hard. It's hard to make eye contact. It's hard to be present. And, we all have those moments of discomfort. And it does make a difference for people.
Absolutely. And a comment came in to us that says this individual practices with her social worker before she has hard conversations. So echoing what you just said. One last question before we begin our wrap-up. These strategies, have you found that any of them are more or less effective in a telemedicine type environment?
Well, obviously, telemedicine has barriers in terms of eye contact and body language. It can be tough. So I think even more than ever, it's important to still make pause for some rapport building and giving pause for listening. And it can really be a different cadence. And for those of you who may be less familiar with doing visits on the phone, or maybe you've been starting video visits, I think getting comfortable with those technologies and even having some notes. I was looking at my notes while I'm talking to all of you, right? So in a way, that's easy. I can have a script ready. So, I think having some little aids to help you can make a big difference.
Wonderful. And Dr. Cooley, thank you so much for joining us today. I don't see any other questions for us, so I just want to say thanks for joining us. Thank you for your time, and numerous comments in the chat are just saying how much they appreciate this talk today and these tips. So It has obviously been well received by not only myself, but our attendees. So thank you again for joining us today.
Well, I welcome you to reach out if we can be of assistance. And we do have some things like video resources on having a telehealth conversation, especially in the context of these 5 quick tips. So I'm delighted to be here, and I just really appreciate the work that you all do. So thank you.
Thank you very much. And if we do receive any questions after the fact, I will ensure that we can put those folks in contact with you for some additional tips and tricks. So let's go ahead and advance towards our conclusion today. We do want to inform you, if you aren't aware of, the kidneyhub.org. This is a new resource for patients and professionals. It is most importantly, it is a mobile-friendly web tool. The resources that are on the NCC website are very helpful, not necessarily the most mobile format. So this Kidney Hub condenses those resources into a mobile-friendly, secure web tool, which was developed in conjunction with feedback from the ESRD NCC's patient subject matter experts. It has important resources, obviously COVID-19, as well as many other resources on well-being, infection prevention, home dialysis, etc. And it's useful for education for both experienced patients and new patients as well. So we encourage you to go out and take a look at that resource on your smartphone or your tablet or any other mobile device you might have, and send us your feedback on that as well. So very quickly, our next events will be coming next week. Our patient-focused events are always on Tuesday evening. So next Tuesday is June 2nd, 2020, and that'll be at 5 p.m. Eastern. Our provider-focused event will be on June 3rd. That's Wednesday at 5 p.m. Eastern. And both of those events are going to circulate around the topic of preparation for disasters/hurricane season, if you will, combined with this COVID-19 pandemic. Should be a very, very interesting talk, and we hope that you will join us for those. If you'd like to, you can visit www.kidneycovidinfocenter.com. Information on both of those events are out there as well as links to register for those events. And so we do encourage you to take a look at that and register if you'd like to join us for those 2 events. So this brings us to the conclusion of our event today. On behalf of the ESRD NCC and, of course, myself, I do want to thank you for your attendance today and your attention and your great feedback in the chat window and Q&A window. I can attest to you that it is very, very helpful and very, very appreciated by us on this end, all of the comments that you do submit to us, and we do look at them and appreciate them. We do have resources available for COVID-19 as well as other resources. For the Kidney Emergency Coalition, CASER, the website is there on your screen. It's www.casercoalition.com, and there are COVID-19 resources at that particular link, as well as what I mentioned earlier, www.kidneycovidinfocenter.com will take you to our NCC COVID-19 resource page. So again, I just want to wrap up by thanking you for your time, and we hope to see you on a future Quick&R. Have a wonderful evening.